Thank you everyone for joining us tonight. I'm Marion Cunningham, one of the directors of This Might Hurt. I just want to lay some groundwork. We're going to be talking a little bit about long COVID this evening. And, when we talk about long COVID, COVID is so new itself, and long COVID, of course, is even newer than that. And we want to recognize that people use this term in a variety of different ways. Some folks have long COVID symptoms that include, heart damage, lung damage, other structural damage that is a clear reason for their symptoms. But when we're talking about long COVID tonight, we're going to be using that term to describe symptoms that are not caused by damage, like structural damage, including symptoms like brain or fatigue, brain fog, other, conditions that we see in a lot of mind-body conditions. And often those folks who have been given a diagnosis of long COVID, they are, some of them have like clear medical workups, like the patients, some of the patients that our film had. So I am going to bring in our last panelist to the spotlight. Hi, Lily. You're on mute, but
I'm unmuted. Hi.
Hey, so I'm just about to introduce you and Michelle here, but I just wanted to lay that groundwork for long COVID. So again, everyone, we are talking about, symptoms that aren't clearly seen on like a chart and that we would expect people to recover from. So if you have any questions about that, put them in the chat. All right, so now I'm going to introduce our panelists. Michelle Wiegers is a certified professional life and mind-body coach, also a writer and poet who discovered her creative voice and mind-body coaching work after recovering from over 25 years of chronic pain, fibromyalgia, sciatica, CFS, POTS, IBS, and symptoms associated with Ehlers-Danlos syndrome. She creates restorative healing experiences with individual clients through her online course, How We Heal Chronic Pain and Fatigue. Thank you, Michelle, for presenting the screening and being part of the panel, of course. And I also want to introduce Dr. Lilia Graue, who's going to go by Lily this evening. She is a physician, psychotherapist, coach, and grief tender in Mexico City. Her approach to collaborative, trauma-sensitive, healing-centered, and mindfulness and compassion-based. Her approach is collaborative, trauma-sensitive, healing-centered, and mindfulness and compassion-based. She brings together radical care approaches to foster healing and mentors healthcare professionals in engaging critical and feminist perspectives to promote justice and equity in medicine and healthcare. Love that. In addition to her work in chronic pain recovery, Dr. Graue has extensive experience in the fields of eating disorders and medical family therapy. She's a clinical advisor for Lynn Health and part of the medical advisory board for the Better Mind Center. I wanted to start with Michelle. Thank you for sharing your story in that part of your bio. And I wanted to know, can you tell us a little bit about your personal experience with those conditions? And especially because we are sort of highlighting POTS tonight, can you also tell everyone what that condition is and how you experienced it?
Yeah, sure. Thank you, Marion, for having me. Yeah, it was a lot of years of variety of symptoms. And if you're familiar with some of how mind-body symptoms tend to present, they do cycle through different parts of our bodies in different times. So for me, the list of symptoms that I had that I recovered fully from 5 years ago, I didn't necessarily have every single symptom all at the same time. So just to clarify, but it really started with irritable bowel syndrome. I was diagnosed with chronic fatigue syndrome and fibromyalgia a few years later, and then really dealt with a lot of chronic back pain, sciatic pain. But if I zoom through, because I won't go through my whole story, but I really the fatigue and the pain got worse and worse through the years. I would cycle through all kinds of different practitioners trying to figure out what's wrong. I always had this sense that there's something under the surface that we're missing, and there's something majorly medically wrong with me. There was actually a point where I contracted a mysterious virus that put me in the hospital with really high white blood count. And when that happened, I also had severe shortness of breath, dizziness, lightheadedness, incredible amount of fatigue. Like, I was so tired that if I sat up in the bed, I would be tired from sitting up. So that's the kind of fatigue I was dealing with, which is really in line with like CFS or the fatigue that can accompany POTS. And so postural orthostatic tachycardia syndrome is POTS. I was diagnosed years later with that, but I had symptoms from POTS for a few years without knowing what it was called or having a diagnosis. But for me, my symptoms presented with POTS, with the dizziness, with variable heart rates, with POTS when you stand up or sit up, your heart rate elevates, and it can be really terrifying, actually. Experiencing those symptoms, they feel and are very physiological, but you might know from the film or from this mind-body approach that there's a huge anxiety and a fear component in the experience of POTS. So when I was in the hospital during that time, I know there were 2 points for me that were really, I look back and I think, I wonder if that was really what was exasperating my experience of symptoms, because I had a nurse tell me, oh, well, your white blood counts are so high, you're like a cancer patient. And I was like, wow, you don't tell a patient that. And then there was another experience. I was home before I'd gone to the hospital with the breathing issues, and it was so bad. I was really afraid that I was not going to make it, or that there was something really scary under the surface. So to fast forward from that, those 10 days, they did a lot of tests. They all came back negative, and it took me months to be able to like walk without getting winded. I was constantly short of breath. I went more than a year with never really bending over, because if I changed my head position, I would get dizzy and fall over. I would like pull up a chair to my fridge to reach down to the bottom drawer to get like an apple, because like I couldn't bend down. And so I really tried to adjust my life around this weird dizziness, tiredness, really extreme. I can remember, taking a shower or trying to climb my stairs. Those kinds of regular life activities became very draining. And that's often what, a CFS symptom as well. So to end the POTS sharing part, I did go and get a test done, because my doctor was trying to figure out what was going on. And I got a tilt table test, which, if you're familiar with POTS, that's like the hallmark diagnosis. And so the cardiologist at Dartmouth Hitchcock, I live in New England, diagnosed me with POTS. And I asked him, I said, what does this mean now that I have this diagnosis? And he's like, well, we don't really understand much about POTS yet. And so I can't really give you a prognosis, and I don't have many patients. He basically was like, I don't actually know, even though he's an incredible doctor at Dartmouth Hitchcock. So that's kind of a very brief description of my experience of POTS and how debilitating it was. Does that answer your question, Marion?
Yeah, definitely. I want to get back to some of the topics you brought up in that answer in a moment. But I'd love to also ask Lily. I know you've also had experiences with chronic pain. Can you talk to me a little bit about how, as a physician dealing with that? And I know that and certainly no MD necessarily comes out of medical school knowing about this type of work. So can you talk about your own chronic pain experience and how, if and at all, that led you to the work you're doing now, or how that sort of came about?
Yeah, sure. So, in med school, we are taught about biopsychosocial models for understanding health and illness. That said, I would say training and most Western classifications of diseases are very leaning towards the organic to the exclusion of everything else. So meaning we lean heavily on anything that can be documented with scientific evidence that points to a biological basis. And the rest of it is either non-existent, or we don't really understand it, or we can't really explain it in ways that we feel comfortable with. So that leads to unfortunate experiences for many people who are just dismissed by their physicians and or other medical providers. And I would say that was my case. And also I will name the fact that living in a female body is also a source of being dismissed by the medical system in many instances. And so at the beginning, it started with an injury for me. And I was constantly dismissed, like, this is not a thing, nothing happened. Then I finally got imaging. And what I want to name also is I'm a physician. Even with that level of privilege, it's incredibly difficult to get the level of care that everybody deserves. So anyway, long story short, I had an injury, had surgery, complications from that surgery, second surgery to fix the complications of the first one. But this was during a protracted period of time. And then after the second surgery, I had lingering pain. And I think that part of my experience was having been dismissed and disbelieved that there was something going on, made me constantly question whether there was something structural that had been missed. And so I had tons of imaging. I was told that I had SI joint dysfunction, so sacroiliac joint dysfunction, which was a common complication of spinal surgery. And I had lingering pain, so basically lower back pain and hip pain. My neurological symptoms resolved after surgery and neurological rehab. I had lost reflexes and sensitivity and strength. I recovered all of that, but I had lingering pain, which became chronic pain for almost 10 years. And I was already practicing mindfulness and compassion. And I would say that enabled me to better manage my pain, but it was nowhere near relief. And then I had some things that kept me going with an okay or acceptable, what felt like acceptable level of everyday pain for me, including swimming and CBD oil. And then the pandemic hit, and I had no access to any of those things anymore. And I was bedridden. And 3 different people recommended that I try out the app Curable. And I was like, I have nothing left to lose. I was fully convinced that my pain was still structural. But then I was invited to consider the possibility that these mind-body practices would bring about a maybe 10 to 30% improvement. And I thought, okay, I'll take it. Like, I'll take anything. I'm curious. Let's learn about this. And from being bedridden, in a month, I was having pain-free days, which felt almost miraculous. And I was like, okay, I need to learn what this is about. So I just dived into all things mind-body medicine and started training in that. I then did a group process. I would say within around 4 months, I was completely pain-free and have remained pain-free ever since. This was a bit over 1.5 years ago. And I started completing the pieces of the puzzle, so to speak. So learning more about the ways in which our thoughts, emotions, and relationships have a direct impact on our physiology and the way our nervous system functions and the way that impacts all of our systems, basically. So gastrointestinal, cardiovascular, skin, everything, basically any and every symptom under the sun can stem from these processes that, again, are biopsychosocial. There's a biological and physiological substrate for how these symptoms manifest, but that doesn't mean that there is a structural cause that needs to be addressed. For example, we always need to rule out tumors, infections, fractures. But other than that, and even in the presence of that, these mind-body practices can bring tremendous ease and healing.
Amazing. Wow. So only 1.5 years ago, that's amazing. Michelle, I know you also used this work to recover, and you've now become a mind-body coach. Can you tell us a little bit about, what coaching can offer? Because of course the film shows, our patients going through this in an MD setting. But I think, especially over the years, people have healed in many different ways, books, podcasts, films, therapists. So can you talk to us about like the coaching element and how it's different from that, medical or mental health setting?
Sure, that's a great question, Marian. And I actually spent a good number of months considering, do I want to train as a therapist or do I want to train as a coach? And I decided for me, coaching is a very dynamic setting. It's very unique to, it's very different than therapy, but in the coaching setting, in a broad sense, the client's setting goals, they're really working on those goals in a session and in between sessions. And there's a lot of forward movement. And because I knew the power of mind-body science and knowledge and practices and tools, and also the power of really understanding our story and how the experiences of stress and repressed emotions, even the way we treat ourselves, how that all affects the body, I really had this sense of like, we don't need a lot to be able to make progress. And it's been true. I've worked with clients who have been very severely hampered by symptoms, and within 10 sessions are back to their normal lives. Now, that doesn't happen for everyone, but in a psychotherapy context, it's usually, it's just a different model and a different approach. So, but what I do with clients, I mean, I always start by asking them if they've had like, major medical causes that Lily had referred to before. Having those causes ruled out is the first step. And then really understanding how to rule in. There's a framework that Dr. Schubiner gave us in his practitioner training for how to think about ruling in mind-body symptoms. So I do that with clients as well. And then we really explore understanding how their personal symptoms show up in the body and looking at the context of their life story of stress, of difficult life experiences, trauma, emotions held in the body, and then using that context to really help them start to what I always call this. I mean, I made this up with clients, but like making an emotional map for themselves. Sometimes they find links where some clients will start recognizing, oh my gosh, I feel anger in this part of my body. And they're starting actually to associate different emotions with different parts of their bodies. But what's really the goal is twofold for me in coaching. One is to use pain reprocessing therapy techniques like somatic tracking, graded exposure, and other tools where you're really using mindful presence and being aware of what's happening in your day-to-day life as far as what thoughts are maybe perpetuating symptoms or exacerbating symptoms. And the goal becomes to reduce fear and to increase safety in that like present moment. Also, another way into this into healing with clients that I think is so valuable, and which I found, like when I was healing, I started with Dr. Schubiner's book, Unlearn Your Pain, because a friend had healed her symptoms with that book. And that was such an incredible start for me, because in that book, he talks about emotional awareness and expression therapy, or at least connecting the emotions or the deeper what's going on under the surface of these symptoms that you're experiencing. So when we can first reduce fear and create safety through pain reprocessing techniques, but then also, and really I encourage clients to become to like this sense of like having daily rhythms and practices that are going to help establish and increase a sense of safety. But then we also work with becoming aware of the emotional connections to the symptoms in your body, and where those are linked in your story, either if it's current life stress or the past. So we become aware that emotion is driving many of the symptoms. And then also the goal is then to become, well, how do we express it? How do we release it? How do we get it out of the body? And so I have a variety of tools and practices that I use with clients, and everyone's different. I tend, you mentioned that I'm a poet. I'm a very intuitive person. So I tend to coach very intuitively and really follow the client on how they're leading. But I also really appreciate the coaching aspect because my experience with therapy was really powerful when I went to a therapist myself. But there is a bit of a distance in that relationship. And I find, especially in mind-body healing, that it's powerful for me to say, I remember when I was healing and this, right? And to be able to share that aspect, which in a, a more traditional therapy session, that's not really what's done. So I felt like most of the people I work with are people who've had similar symptoms that I've had, or maybe they've had decades of symptoms like I have. I had symptoms for like 26, 27 years, and it ruled my life. And so I tend to work with a lot of clients with CFS, with POTS. Sometimes I get pain clients, but it's mostly long COVID. I have long COVID clients as well. So people, yeah, I think they resonate with my story and my healing path. And I think coaching isn't going to be the model for everyone. Therapy isn't going to be the model for everyone. Like, it's not the cure-all, right? But it's a really dynamic setting for making change in your life and for healing mind-body symptoms.
Yeah. Lily, before you were mentioning, all the challenges to, getting medical care, of course, being in a female body, all the privilege that you have, and you still weren't able to access this work in a timely manner. As someone who spends a great deal of their time trying to get this work into medical schools, therapy offices, anyone who will listen, why is that? What can we do? Give me the tips, please. How do we make them listen?
I was muted. I was going to say that's like the $1 million question. I don't have a solution. I have, I don't know, threads to start connecting. So one of them is educating ourselves more and trusting that our narratives of what is going on in our body are valid. Because often we just fall into these traps of being labeled with a certain diagnostic classification by the medical establishment, which then has an impact in how we perceive ourselves and how we create an identity as a sick person or as a disabled person. And then just, it kind of intensifies that cycle of conditioning. And then if somebody is told, well, we don't really know what to do with this, you're probably going to have to live with this your whole life, or we have no available answers for you or treatments, or you try over and over again with a zillion different treatments, it just perpetuates that cycle of the threat response. And that amplifies the symptoms. And so the more we start educating ourselves and trusting that our narratives for explaining, and that what we have an intuition around, what Michelle was just saying, I have an intuition that just links to this experience, or this connects to that relationship, and starting to bring that to the surface and addressing it. And my dearest wish for my fellow physicians is just really listen to people instead of just trying to be right and have the truth. We're all human and we learn from each other. We don't need to have all the answers or push a diagnostic category on someone, or push a treatment that we know doesn't work just because it's the only available option to us at the moment. Just start getting more curious and learning more and questioning everything. Because I don't know, a lot of us just come out of med school thinking that we have all the answers and we're going to tell people what it is. And then that makes us not be humble and not be curious. And it blocks all opportunities for learning. And so I think at its core, the whole question is about how do we learn to be better humans together in terms of being kinder and more compassionate, open listening to each other.
Amazing. Yes. So much in there. That's a very rich answer. I really appreciate that. I want to ask a couple questions about long COVID. I know folks are excited about that one. So Michelle, I know you've seen a string of long COVID clients. Obviously, again, long COVID is new, so it's probably changing every day. But can you talk about the changes you've seen from the patients that you've had who have been able to access this work?
Yeah, I should contextualize and say, I think I'm thinking, yeah, every client that I've had with long COVID, they find me because they've found the mind body work. And that's actually often people who I don't know why this is the case, but it seems like most clients that I start to work with, I get people who've made progress, have really introduced themselves to the mind body approach. They understand what's happening, in the fight, flight, or freeze response and the danger signal being triggered in the brain. They understand the basics of that, and they've even tried some practices, and now they're stuck. Or they've had a book cure, which I don't know if our listeners have heard that term, but like they've read a book and they're like, oh my gosh, this is what's happening. And then like, boom, symptoms are gone. And then they've cycled back and they're like, well, now what? So, so I should contextualize to say that I think every long haul COVID client I've had has come in already having made some progress for themselves. That doesn't mean that I couldn't work with someone who's brand new to it, though usually I think it's better. It's why I teach my course, because I think it's better to have a big, broad introduction and then work one-on-one. That's what I tell people who reach out to me, because you can gain so much progress by yourself first, and then yeah. So I'm gonna piggyback on what you said, what you started the call with, Marian, as far as saying that just like any other symptoms, when we're talking about the mind-body approach, that you have to have major tissue damage, structural causes ruled out. So if there's lung damage or heart damage or any other medical thing happening for that client, this approach is not going to necessarily help. But when we can rule those things out, then we can start to work with what's going on. And really, I work with long haul COVID clients in the same way that I do others. We start with a symptom timeline. I have a pretty extensive life inventory that I have all clients start with, so I can get to know them. It gives me a jump start to get to know them. And we look for the links between, oftentimes we look at what was happening in their lives when the symptoms started. Now, not all long haul COVID clients actually have contracted COVID. Some of them got symptoms when they got a vaccine. So many do have, but if you look at the research, not everyone who's presenting with long COVID actually has contracted COVID. So I don't know that I could give you a pattern, except to say that, to state the very obvious, people who are contracting COVID were in the middle of this pandemic, especially early on, but any time in the past few years, right? Like this was happening in the real time of like this fearful environment that we're all in. So it makes sense that when you understand that mind-body symptoms show up because of fear response in the amygdala being triggered, and there's that danger signal response. I mean, to be able to contract COVID and then continue to have symptoms happening, so often there is a major fear component to that keeps the symptoms going. So what we start to do is we start first with what increases safety, and how can we start to really, usually that's ruling in the mind-body cause, and really wrestling with like, what are the long list of either diagnoses or medical explanations that the long COVID client's been given, because every doctor and practitioner is grasping at an explanation for what's going on. And so, so that's often where we start, and then we move into, the stress causes. For many, I will say for many, maybe all, for most, I'll just say, of the clients I've worked with, once I start asking about symptoms, we start looking in their history, and there'll be migraines or TMJ or back pain or some fatigue issues. So oftentimes it's not the first time, or even just anxiety, because underneath the symptoms of mind-body symptoms, almost everyone has this layer of anxiety. And so we look back in their history and we see like long COVID symptoms that are presenting for them are mind-body, but they've also have a history of some other mind-body issues. So if you're experiencing long COVID, looking at, the list of typical mind-body symptoms on the PPD website would be really helpful to say, okay, what is typical mind-body? Do I remember having any of these other things? And could that then maybe be an indication that what I'm experiencing now has the same root cause, the stress cause component? So
Yeah.
feel helpful. It's kind
Yeah.
of a scattershot answer, because
No, I mean, I think, no, it's great. I mean, I think we see that a lot. If people have one mind-body condition, they've probably had another one at some point in their life that maybe they did or didn't know was mind-body. But Lily, like turning to you with a, similar vibe, like what are long COVID, or people who think they might have long COVID or have been diagnosed with it supposed to do? You're going to the doctor. There's not necessarily a test to like rule long haul COVID in, right? It's just sort of like ruling everything else out, and probably, seeing if there's a way to tell if you've had COVID. So as this particular disease or condition, I would say, becomes more and more popular, how do you, what are you supposed to do when, the entire medical industry is telling you that you have this disease, and that they don't know much about it, and it might not get better?
So I would say this might not be the answer that you were looking for, but I would say that for me, the role of conventional Western medicine in this condition is ruling out structural damage. And if there is structural damage present, then providing PT, OT, medication, whatever is necessary, pulmonary rehabilitation, that kind of thing, to support the person's health and well-being. Beyond that, I think that conventional Western medicine has very little to offer, because it doesn't address the whole context of how this originated. It doesn't address, not many physicians are very either experienced or knowledgeable about the field of, it's a long name, bear with me, psychoneuroimmune endocrinology, which basically in layman's terms means that thoughts, emotions, relationships, and social context have a direct impact on the physiology of our autonomic nervous system, which regulates so many different functions in our bodies. And the solution is not pharmacological, it's not drugs. The solution is not surgery. Recovery and healing are about very much around what Michelle just highlighted, creating a sense of safety from an understanding that this condition generated from all of these conditions in a particular social context, with a social narrative about how horrible and dangerous this is, and a media barrage of news around, oh, long COVID is affecting so many people in the world. So if we look at different infections, it's not uncommon to experience a viral infection, and then as our body is healing, for instance, we can stand up and then our heart rate increases and we get lightheaded and dizzy. And then we associate, because we have an unconscious threat response that couples standing up with danger, we associate standing up with danger, and then that link remains even though the viral infection is gone. And that happens with many other things. We have days when we're really unable to concentrate very well or pay attention very well because all of our systems are busy fighting an infection. But then we start experiencing these events around particular conditioned responses or associated triggers. And then we start experiencing what we call brain fog. And then that triggers more fear and more somatic vigilance, which means being more attentive to the background white noise that is always present in our bodies. So at any given time, there are a gazillion things going on in our bodies and many different sensations that we don't necessarily pay much attention to. But when we are told by the news, by the medical system, by other people around us, oh, be careful, long COVID, it's a horrible thing. And there are all these symptoms that you're maybe going to experience. And then we're on the lookout for that after maybe experiencing some adverse effects from a vaccine, normal, a little bit of arm pain or dizziness or tiredness because our immune system is kicking into gear, or the normal responses we have for fighting an infection. And we start to develop a hypervigilance around that and being afraid of everything that's happening in our bodies. And the fear just amplifies the dysregulation in our autonomic nervous system. And so the answer is in nervous system regulation practices and in not believing everything to be the absolute truth when it comes from a medical narrative of this is a thing we have no cure for, or no solution for, or no hope for, because medicine doesn't have all the answers, but our bodies have an amazing healing ability. And it's just about engaging and recruiting those healing mechanisms that are embedded in our bodies and in our community. This is not something we do alone.
Yeah. Yeah, I mean, it can be so difficult because, from the time you're a small child, you're taught like, oh, the doctor will heal you, like if you get hurt, you're going to be okay. And so, we're taught to really trust medical folks. So it's really hard when they don't have the answers but they keep telling you like, oh, you're sick. Oh, there's something wrong. We're gonna figure it out, or it's gonna be like this for a long time. It's just like very difficult. I also was very impressed that you taught me a new word for mind-body syndrome during that answer. I thought I knew them all: mind-body, TMS, stress illness, a whole slew of them, but now there's a new one, which you might have to email me because I was a little too long for me to remember right now, but I definitely want to learn it.
Do you mean the psychoneurum,
Yes.
endocrinology? Okay.
Yes. Okay, next question. I'm gonna move to some of our chat questions. Michelle, how do you work with ME/CFS patients who become fatigued even by talking? And I think, if we broaden this question out a little bit, I think kind of what Lily was just talking about, when you sort of expect to have these symptoms, your body can create these symptoms. Some of them are going to impede your treatment or your, healing if they are, that difficult. So how do you break past that barrier when you're working with a patient who, believes or who experiences fatigue on such a grand level that even having, an hour-long session with you would be really difficult?
Well, that's really, thank you for asking that, Marianne, and whoever. I didn't see.
Ruth, sorry, that was Ruth's question.
Yeah, thank you, Ruth. That's a really difficult set of symptoms to be able to work with, as far as if talking is itself is draining. And that's an extreme, case for fatigue. It doesn't mean that there's not hope for that. And I would really encourage anyone who's dealing with that severe of chronic fatigue or CFS-ME symptoms to start really slowly. Probably one-on-one coaching right from the get-go is maybe a little too intense. But if it's a brand new introduction to the mind-body approach, to be able to start to listen to podcasts, to watch, there's a lot of education that you can access. I know that This Might Hurt Film has tons of resources on their website. And so, I mean, this is not me, I'll get to what I would do with a client, but I'm not kidding when I say that it's really valuable to start the work yourself as far as understanding what's going on. And because what you want to do is be able to expand your capacity beyond what you think that you can handle. And that seems like an impossibility when you're plagued with symptoms that, I mean, I can remember, I don't know if Ruth, you or anyone else with CFS has experienced the spoon analogy, where you have only so many energies of, spoons for the day. And once you're out, you're out. And so in that sense, there's like, well, I only have 5 spoons today, and I've already taken a shower, and that's one, and I've done this and I've done that. And so I'm done. And so there's always this understanding of CFS is this, and this is what it does in my mind and my body. But when we can start to shift out of the realities of like CFS is this, and this is who I am, into recognizing maybe I don't have that, or maybe there's something else going on. Can I look at this experience of symptoms from a different perspective? Can I start to interpret when I get a huge crash, instead of looking at what I've done physically, look at what's happening for me emotionally? What's going on in my life that day or circumstantially? It doesn't mean, by the way, that it's always linked to something specific in the day, because when our nervous systems become dysregulated, we can have a general malaise and fatigue all the time. It doesn't necessarily spike and lower with what we're thinking and feeling, but it can be affected that way. So if I had a potential client who was really that fatigued by just speaking, I would start start with assignments and start with what she or he could share the time and space for, and to recognize that this healing work does take a certain amount of capacity. It doesn't mean that we have to be able to do meet for an hour. We don't have to take a 3-month-long course. Like I teach a course that might be too much, right? But there are ways to be able to start to teach yourself, and as you do, that can start to calm the danger response and start to maybe expand a little bit beyond our current capacity. And graded exposure is the same way. When we're returning to physical activity, we don't start by like, if we were bedridden or we were homebound or mostly on the couch, whatever, we don't start by like running 2 miles. You start by imagining walking, and then you move through into actually physically doing something. So what's really becomes important is to take slowly titrated steps. I would say as well, what can be helpful, everyone's different. Some people that I work with start with the body. And so we start with the somatic practices, and we let the body lead us in what's tolerable. And that's for some of us, and I was one of these people. I was so disconnected and disassociated from my body that I got nothing. Like I couldn't start there. I actually needed to start from what was going on medically, what was going on in my life. And so I want to share that in the sense to say there are different ways in, and there's different ways to start. But what I would encourage you, if you would all feel like the film, what was happening for people and the pain that they were recovering from, if that at all resonates with you, or if you have that question mark, like, well, can this apply to CFS? It absolutely can. And there are a lot of people who have recovered from CFS, even watching recovery stories. There's just different ways to start to build a little bit more capacity. Almost thinking about like that rubber band illustration. You don't want to stretch it all at once. You want to expand it and then contract, let it contract and expand a little and let it contract. So that's how I would do it, moving slowly with a line like that. Does that?
Thank you. Yeah. We've got about 10 minutes left. So get your final questions in, and also panelists, let's go rapid fire. Let's try to get everyone's questions answered. Lily, someone private messaged me this question, so I'm not going to say their name, but question asker, if you would like to make yourself known in the chat, please do. But can an eating disorder be classified as TMS? And if so, how can it be addressed through this framework?
Okay, great question. Thank you. So I actually think that ties into another question in the chat, which is around if someone has been diagnosed with a structural condition, can they still be helped by this approach? And I think it's very unfortunate that we that our language makes this dichotomy of structural or non-structural. Whereas for me, it's more of an understanding that every single thing that happens is biopsychosocial, but the relative weight or contribution by these different realms for each person will be different. So yes, absolutely everything in the realm of symptoms has a participation or contribution from neural circuits in our brain and central nervous system. And that applies to eating behaviors. It applies to addiction-related behaviors. It applies to the relationships we have with our partner or mom or friends. It applies to symptoms in our bodies that have become perpetuated and chronic through repetition. So yes, eating disorders, in my opinion, can be addressed in terms of learned neural circuits that we can unlearn, because everything we learn can be unlearned too. And our learning ability is lifelong, so we can create new neural circuits. And at the same time, for any given person, there can be complications from an eating disorder that involve different organs and systems and that might merit medical intervention. And I would say, to complement my last answer, it's really important that we seek providers who are informed about the mind-body connection and understand this more complex approach, because it involves the biological, the psychological, the social, and the spiritual too. So I hope that answers the question.
Definitely. And for anyone who is looking for a provider, we've talked about a lot of different ways to heal using this framework. We've talked about book cures and of course watching our film, but there is a number of lists of providers that are on our website. And one of the ones we really trust is the PPDA Association website, which has we link to it on our site, and it has a list of practitioners in every state and a few additional countries besides the US. And then also folks who can work online and across state lines, because of course there are some restrictions around that. Okay, Michelle. Another question is, at what point during post-viral should someone start to challenge their symptoms? They are coming from an experience that is 1 month into post-viral with severe POTS, and they have had TMS in their history, but they're struggling internally about letting their body rest fully versus adopting the mind-body approach. So, to think about that a different way, it's like, how do I trust, even though I've had TMS in the past, how do I trust this one is TMS, and how should I approach it?
Sure, that's a really good question. And I may even bat it a little bit to Lily, but my initial response would be that technically, like, the chronic definition of chronic symptoms is 3 to 6 months. So 1 month is a really quick turnaround to start evaluating symptoms. That said, from my understanding and Dr. Schuppener's training, and I would love for Lily to comment on this, that from his perspective, all experience of POTS is a mind-body process. So if the symptoms are POTS, I mean, yes, I was diagnosed with a tilt table test, and I was told that I had POTS, and the cardiologist immediately said, I'm not exactly sure what this is, like, basically. So he was willing to say, yes, I can see that your heart rate elevates with, as we, whatever, as the tilt table test was done, but he also, in the same breath, said, I'm not sure what we can do for you medically. And so that's my initial response, is to give it time, but there's nothing in the mind-body healing practices, knowledge, or tools that's harmful. In fact, so many of them, really, when we get down to the deeper root cause, a lot of the time we need to increase self-compassion and decrease self-pressure. We would need to increase, I've said it already, but increase the amount of safety, the sense of safety. And that can be in in our relationships, in our home life, in our work environments. So when we start to apply this method, it's really a life-changing construct. It's not something that's going to inhibit us, but really just help us. Lily, do you have anything to add to that question?
Yeah, thank you. I'll piggyback on that and say that, well, first, let me take 2 steps back. I wanted to address the question of diagnosis. And I think it's really useful to keep in mind that a diagnosis offers the best explanation available in this moment in time, given the information we have, to describe what is going on. Most medical diagnoses are just that. In this moment, the cluster.
Oh no. Okay. Well, hopefully Lily will get back to us. Michelle, we have just a question of like the best strategies to get the autonomic nervous system out of the stress response. So maybe can you just share 1 or 2 that you find like the most helpful for your patients or clients?
Yeah, are you talking about specifically with POTS? Is that what you mean? I mean, autonomic.
Yes,
POTS
yes.
is autonomic.
COVID-induced POTS-like symptoms.
Yeah. Well, it's hard to share 1 or 2, but I'll try. Breath work is helpful for a lot of people in regulating the nervous system. There's certain kinds that are more activating for certain people and some that are more relaxing for others. I'm bringing that up as a tool that a lot of people access. It's not one that helped me. So I'm not saying it from my personal experience because I don't know. It didn't help me initially. It's something I use now. But there's also the sense if you understand when we understand that the
I'm
the
back.
physical-
I'm so sorry. Internet just died on me.
Oh, no.
No worries. Question asker that we just filled in a question for. There are probably a lot more resources on Michelle's website too, so you can find it there. Lily, do you want to go back to what you were saying?
Yeah. Thank you. So yeah, diagnosis is basically we give a label or a name to a cluster of experiences the person is coming with. So some things we can observe or measure, those are called signs, and some things are said by the person to be experienced. So they're symptoms. So at any given time, we might say, oh, okay, so this person is experiencing dizziness and lightheadedness and instability when standing up. And then we do a tilt test, and then their heart rate increases X beats per minute after the standing up. And then, okay, so we label that POTS. But that only means that we're giving a name to describe something. It doesn't mean that POTS is a thing that exists in itself out in the universe and then lands on us and affects us. So I think it's useful to think of that in terms of not being limited by the diagnosis. And to piggyback on what Michelle was saying, we build capacity through tools that help us regulate our nervous system. Nothing that we do in the service of regulating our nervous system is going to harm us, quite the opposite. And so if we engage in those practices, what we are doing in essence is engaging the healing capacity of our mind bodies. And again, we can recruit the co-regulation aspect of it, which means doing it with another or with others in community. And that's why it's often so helpful to work with a provider who is skilled in this field, because then we can get that benefit of the co-regulation and build capacity with time. And the reason why we do graded exposure, so in other words, increasing gradually what we are doing, is just to show our brain that it is safe. Our brain and our threat response system will take a little bit to catch up to the fact that, oh, these sensations are not dangerous and this thing I'm doing is not harming me. It's not dangerous for me. It's not out of a sense of the body is fragile and we need to make sure you don't hurt yourself. It's just, this is absolutely safe. And we need the part of you that it's activating the threat response to catch up to the fact that this is safe.
Awesome. Thank you so much. We are going to have to say goodbye to everyone, but I would love our panelists, Lily, maybe we'll start with you, just to, any closing thoughts and where folks can find you, or whatever, you'd like to share about what you're doing next with the members, audience.
Thank you. Yes. I would say the one thing I want you all to leave here with is the embodied knowledge that your body has an infinite capacity to heal, and that there is absolute hope for recovery from POTS and post-COVID syndrome and all other symptoms that we call either TMS or neuroplastic. And thank you. Someone shared my website on the chat, so that's where you can find me. And yeah, I'd love to hear from folks.
Great. Michelle.
Thank you so much, Marian. This has been really great to do with you all. I think the thing that I want to share, and it's something that students and clients are constantly coming in for me with into working together and worried that they're going to miss the key tool. And so often there's a frenzy of like, I've got to listen to all the podcasts, I've got to get all the books, I've got to get all the tools, I have to make sure I have everything. And there's this panic mode of like, I'm going to miss the thing that's going to help me heal. But what's really going to serve you best is recognizing that you are your own best advocate, that you can follow, you can listen to what's resonating for you. And like I said, if breath work isn't something that works for you yet, fine, leave it aside. Maybe somatic tracking will be incredible for you. If that's too intimidating or hard, maybe a journaling practice will be supportive for identifying what you're feeling and experiencing. There's different paths into this work, and you don't need every single one of them. So that's something that I just want to encourage you, and honestly, watching healing interviews and stories can be really, really supportive for helping to see how other people have done it and what's sort of calling to you and resonating for you. I do have, it looks like someone shared. So I have a course that I've developed called How We Heal Chronic Pain and Fatigue. And I've taught it for a few years now, and I'm teaching again in September. And it's a very robust mind-body deep dive into a lot of different practices and tools and teaching, and a ton of different personal reflection exercises and handouts. And so my intention with the course was basically to present these different paths and ways in. And so that's something that I love doing, and it's powerful to learn alongside of in community with one another. And I guess you can see that, yeah, I work one-on-one with clients as well, but I really love the community aspect of the course. Reach out if there's ever anything that, I can be supportive in.
Wonderful. Thank you so much, both of our panelists, for joining us, for sharing all of this wisdom. It's been a lot of really wonderful ideas shared. And so I hope if anyone has any questions, they'll feel free to reach out to our panelists or to us. This Might Hurt. We have like a million resources on our website. So if you have any questions, just find them there. And then links to all the other places too. So thank you again for spending your Wednesday evening with us. And everyone take care. Bye.
Thank you,
Thank you, everyone. Bye.